Okay, we've just had a quick chat with the councillors. We're now coming out into the main body of the Orwell Hotel, where we've got about 35, 40 stands, and one that we've alighted on is the Alzheimer's Society. And we've got 3 young ladies here, all fighting fit. They've all been for their early morning dip, a long swim. And I understand that you are now the lead lady on Alzheimer's Society for Suffolk. Is that correct or somewhat incorrect?
Volunteer campaign lead. Whereas it's all about raising awareness and identifying gaps in services and making sure that people know about us and know that they can come to us for support. And it's
so how, this is the sort of the county-wide, I don't like to appear selfish, but what I'm really interested in is what are we doing with regards to the Felixstowe Peninsula? What group do we have here?
Well, we have the Felixstowe support group.
Right, and who leads?
That is led by one of our dementia support workers.
Right.
Supported by these 2 ladies who are very experienced volunteers.
Right.
And that is open to anyone with a memory problem or wants to be who has any type of dementia. Right. And also very important is the people that care for them.
Indeed, it does.
Because
caring for the carers is a big part.
That is a big priority.
Process.
And quite often, in the early stages, people with dementia come to us, but it's very important that the carers come to get some respite, right, so that they know where to come for they can see the support worker to discuss their circumstances, what help they need, and we support them to get that help.
Okay, so our local group
meets on us.
And do we have a little exciting leaflet?
We do.
And that's at St.
Yeah, it meets on the second Wednesday morning of the month at the little room at the back of St. John's
Okay, well,
Church.
I think our editing staff will get that as a part of this clip. But what we would like to do is to extend an invitation to you to come to the Gainsborough studio sometime in the future, and we could have perhaps a more in-depth discussion about, how it develops, how you can care for the carers, and the fact that people aren't alone, because is quite frightening.
It is quite frightening because people don't know where to go when this happens, and they don't know if they don't know much about it, and it's important to let them know that there is support out there.
And we live through it. We do.
If the earlier they're diagnosed, then we can help them get that support.
Okay, well, thanks very much for your time, and we'll be back in touch.
All right.
And I hope you have a wonderful day.
Thank you very much.
Not that I would wish that you have an increasing number of clients, but those that are there need all the help they can.
The ones that need help, we want them to come to us.
Okay, thank you very much. Hello again. The next door we've got to is our own redoubtable Felixstowe Library. And you are now becoming a much more integrated information source for what particular areas of health?
One of the services we do is the Mental Health and Wellbeing Information Service.
Right.
So there's a link on our website to lots of support, lots of further reading, all to do with mental health and wellbeing.
Okay. Now, are you amenable or open to other groups, say cancer or stroke, being able to start to meet in your facility? And if they were to do that, what would it cost them?
We've got a room for hire. We've got 2 rooms for hire, a small meeting room and a big meeting room.
Right. So you are going to be a growing source of information. What we're particularly interested in are groups that have a particular relevance to the Felixstowe Peninsula. And we do know that more and more people need more and more support.
Yeah.
So thank you very much for that.
You're welcome.
And we would like to invite you, or we would come to the library at some stage and actually record that, and then put it up on our website so it's available to a wider public through. So thank you very much, and enjoy today.
Thank you.
Thank you, my love. You now find us at the Hope Trust helping older people stand. And how are you today?
Very well, thank you.
And you're getting a lot of interest?
We are. A steady trickle, which is what we can cope with.
Good. Now, your building exists at the top of sort of the junction of Seaton Road.
That's it, Mason Road, Seaton Road.
And what is your sort of purpose in life?
Our purpose in life is to exist to help people who are 50 plus.
So you're age discrimination. Isn't that good?
Don't quote me on that. So we work with helping older people.
Good.
And what we've tried to do is say that actually older people are not frail elderly at 80
No, they're
plus.
not. No, not anymore.
And so, bearing in mind I came to work for the charity when I turned 50, I thought we really ought to include my peer group.
Indeed.
And indeed, if we can work with people in their 50s and 60s to
Yes.
prepare them for 70s and 80s,
then they'll have a better
then
quality
that's
of life
a
going
much
forward.
better way.
Okay, I understand that you're going to be coming into the studio sometime in the future.
That would be lovely.
And we'll do a much fuller bit. But enjoy today.
Thank you.
Hopefully you get lots of support and increase the membership.
That would be marvellous. The more older people we can help, the better we feel.
Yes, I think elders is a lovely term, or seniors. OAP and the rest, the connotation is wrong now.
The more
isn't it?
experienced folk.
Absolutely, and
More
we're here
experienced.
for that. And you find us at the Walton Parish Nursing for the Felixstowe Peninsula. Now, how long have you been in existence?
Well, I've been working for Walton Parish Nursing for a year, but parish nursing in Walton has been for about 8 years.
And the type of service you provide within and about?
It's within Walton, just Walton, or anybody that's connected with the Walton churches, so they can live in Felixstowe.
Right.
And also we cover all ages as well, so it can be, from birth right up to old age.
So it's the whole community?
It is, yeah.
Okay.
Yeah.
And the intent is to give additional support for those who need.
Yeah,
Would that be right?
it's filling in the gaps that maybe the NHS nurses can't do.
Well, sadly, that seems to be an increasing
It does.
level of gap.
Yeah.
I understand we're going to have you in the studio shortly.
Apparently,
But
yes.
hopefully you'll have a lovely day today.
Right, thank you.
And more people will be aware, of your existence and the services you provide.
That's right.
So thank you very much
All right,
for speaking
thank you.
to us. And
Thank
we'll
you.
see you again shortly.
All right, thank you.
Hello, we've now got to young John.
Good
And
morning, Mike.
How are things?
Oh, pretty good.
Now, you've been heading up the rescue craft for how long now?
This is our 15th year that we're entering into now.
Right. How are you doing for funding? Because I know every year is a struggle.
Well, every year is a struggle. This year I'm confident we've got funds to carry on through to the end of the year.
Brilliant.
My present problem is the lack of volunteers.
So you need more
I
volunteers.
desperately do need volunteers.
So they need to be fighting fit?
They need to be fighting fit.
Right.
They don't necessarily have to have a great deal of experience. If they've
Right.
got experience, it's helpful.
Yes.
But we'll train them up to MCA standard and Marine Coast Guard agency standard.
How do they contact you?
They'll contact us via the website, which is simply Guardian Rescue.
Okay. Hopefully you've got that. We will be inviting John into the Gainsborough studio before the season kicks off, and he can tell us all of their daring do's and what their daring don'ts are.
Excellent.
Thank you very much,
Mike.
John.
No,
Happy New Year
good.
to
I'm
you
glad
and
to see
yours.
that
You're going to be the new form of the patient voice in the new health service coming at us in April of this year. Is that right?
That's right, yes. Part of the new NHS structure,
Yes.
Health Watch will be the patient voice going through to the commissioners.
Yes.
So the new clinical commissioning groups that have got the money
Yes.
will have to listen to patient voice about what they want from services.
Right.
People often don't know where to go.
No, they don't.
So Health Watch will exist from April the 1st. Currently Suffolk Link exists, and that's transitioning this year into Health Watch.
Right, that's the annual report that we have
Yep.
on the table.
So most people would have heard of Suffolk Link.
Yes, I think the sort of the join rate wasn't perhaps what people were hoping, but I think one of the things that concerns certainly those of us that have been involved in health for a long time
Sure.
is what statutory powers that you have from a point of view of calling those who should be delivering whatever service to account.
Yes.
So what sort of powers will Health Watch have that, say, Suffolk Link didn't have?
Well, having a seat on the Health and Wellbeing Board is an extremely important
Oh, very
place
much.
to be.
Yes.
It works as advisory and scrutiny of services.
Right.
So the clinical commissioning groups will come to the Health and Wellbeing Board when they go to commission services to
Right.
get that patient voice fed through, to
Right.
find out what people want.
So will you be using the same sort of distribution list that Suffolk Link has been using, or
All
are you going to
members-
create your own?
All members of Suffolk Link
Yes.
will be asked if they wish to become a member of Health Watch. And officially we have to do that under the data protection.
I'm sure you do.
And people have to say officially that they do want to become
Well,
a member of
it's
Health
got to be a
Watch.
positive response, not a negative.
Sure. If they say nothing, we can't take
No.
that as a yes either.
Okay.
So it's very important if people are a current member
Right.
that they wish to continue getting to know about Health Watch and being involved with Health Watch,
Right.
that they do answer positively.
Well,
they do
hopefully
wish to
today you'll have a
continue.
lot of take-up.
Yes, we've had a good thing. The great thing I think about Health Watch as well is that we're looking. This last year, we've been asking the community about how they best will engage with Health Watch. How will they give their opinion? Because lots of people use lots of different things.
Yes, they do.
And we don't want to
And they're becoming more and more diverse.
Absolutely.
Coming from more and more
Absolutely.
deliverers, and you do wonder who is responsible for what. But what I was going to say is that. I hope you have a very good day today, but what I would do is extend an invite to you that perhaps you come to our Gainsborough studios here in Felixstowe before April.
Yes.
And talk us through what the new system is, etc., etc.
Yes.
And then it can go out live stream and we can put it on the website.
That'd be great.
And that would be usul getting out into the system.
Absolutely. I mean, going forward after April, what we've found that the public do want is people to have a face-to-face presence within the community.
Oh, indeed they do.
So we will be looking at setting up what we're calling hubs within various communities, and obviously Felixstowe would be a place that we probably would have one of those.
But what I would like to be discussing with you when you do come is how do we get to the hard to reach groups as well as the worried well?
Absolutely,
because if you look around, a lot of the folk that we've got here today, very few of them are from the hard to reach groups, and that's really where your task starts.
Yeah, we are doing a lot of work with marginalised groups.
Good.
A lot of work already, setting up good relationships with them and trying to engage, and we find that going to them and also linking in with what they access already works really, really well. But also we want to meet Joe Public.
Of course you do.
So we want to get information into businesses, and get their staff involved so that people do know where they can go when they've had an experience, good or bad, within health and social care services.
Well, thank you very much
Thanks
for
very
that.
much.
Happy New Year.
You too.
And we look forward to seeing you soon.
Yeah, thanks
Thank
very
you.
much.
Bye-bye. You're promoting here warm homes, healthy people.
Yes.
Is that right?
Yes.
So what we do know is we've got a lot of people living here on the peninsula as well as throughout Suffolk who are finding it very difficult to heat their homes.
Of course, yes. Fuel poverty at the moment is a big problem.
Yes, it is. So you're stalled here, and I can't show you all the goodies, but had you got here earlier, then you could have joined Angel and had lots of freebies. But basically what we're hoping you will do, and you need to do it soon, I'm told, because this is time limited, the offices.
Yeah, we're trying to get this done by March. So,
are you really?
Yeah.
So we would like you to come to the Gainsborough studio, perhaps with some of this, very soon, so then some use to our immediate community. Because they're not all going to come through the door today. So thank you very much for your time. The voice is gone, the sound is gone, but this is a very, very needed assistance to people who may well be trapped in fuel poverty.
Yeah, we're trying to go into people's homes, and we're offering free independent home energy surveys, and then from that we can refer people to free loft installation, free capital installation.
Right, so
I'm working with Suffolk Coastal District Council on their projects.
So you are the Catherine Osborne of Great Renown, would that be right? The Warms Home Graduate Placement. That sounds exciting.
It is very exciting.
So the people who come to do the assessment, are they council employees, private employees, or who?
Council employees, including myself actually.
You come and do the assessment?
Yeah, I can go around to people's houses and give just little bits of advice.
Right.
We're trying to help those who are most vulnerable in fuel poverty, and just to reduce, the whole aim of the project is to reduce hospital emissions.
Absolutely.
So yeah.
Okay. Here we go. Right. How do you do? My name's Michael. Hello. This is a bit we're doing for Felixstowe TV. Right. And what we're particularly interested in today's event is groups that actually have a presence in the Felixstowe Peninsula, because we do feel that quite a lot of services that we used to have in the past have been migrated elsewhere. So I understand that you have a local group functioning in the peninsula.
almost right. The Disability Advice Service is based in Woodbridge. The way that we actually service clients' needs in Felixstowe is they book a telephone call through the Woodbridge telephone number,
right,
which is 01394.
We'll be putting that up on the website.
Super. 387070. So
right.
Thank you.
So your function in life is what?
My function in life is to work specifically until the end of March for the Warmer Homes Healthy People scheme, and that's working for Optia in the west of Suffolk, Dial in the north and Waveney, and the Disability Service Advice Service in Woodbridge and around the Suffolk coastal area.
So do you know which hat you got on when? It sounds as if you've got a very confusing structure, but not for us to comment.
No.
So I did mention that you are looking to or have a group that function within the Felixstowe Police, so is that wrong?
No, what we tend to do is we actually arrange a home visit or arrange transport for anybody from Felixstowe to come into the Woodbridge office, where the resources are really held.
So where are you in?
Pitches Road, which is just opposite, the council offices. Yeah.
And you're still there, and you've kept your fund there.
Yes, they have.
That's remarkable.
Yes, they're doing very well at the moment. Yes.
Okay, well, we look forward to seeing you in the studio.
Lovely.
And then we can go through it in greater detail.
Lovely.
And undoubtedly we do have in our town a number of disabled folk. And what we are looking to do is to perhaps encourage mutual support between folks.
Yeah.
Because, there's nobody better to advise a patient than the existing patient has been through.
And on the understanding that disability is a very broad spectrum of people.
Since the Paralympics, there are those who say they wish to be disabled so they can be included. Nice to meet you, young man. See you the next time. Bye-bye.